Welcome to Season 2 of Talk Me Healthy. Each month, we invite a guest to explore a topic related to healthy living. They share their expertise, personal stories, and we learn from them how they turned their passion and knowledge into practical tips that you can use now to improve your health. I'm your host, Sherry Keating, founder of Diabetes Care Consulting. My goal is that you will hear something each show that will motivate you to make a small change towards living a healthier, happier life. Hello and welcome to Talk Me Healthy. My name is Sherry Keating and I'm your host. November is National Diabetes Month. So I've asked my friend, colleague, Sandi Knipe. Sandi is actually a registered nurse for almost 50 years. Yep. And she also is a member of the Fitchburg Board of Health and also works per diem as a school nurse in the Leominster School System. But she also lives with type 1 diabetes. So I've asked her to come today to share her personal journey to help educate you, the viewer, on a typical day in the life of someone with diabetes so that you can learn about her diagnosis, the signs and symptoms, and also to see that you can live a full life with diabetes. So thank you, Sandi, for coming on the show. I know your time is very valuable, and I do appreciate you coming on and educating the viewers.
Thank you, Sherry, for inviting me. It's an honor to be here.
Oh, you're welcome. So tell us, when were you diagnosed? How were you diagnosed? What were your symptoms?
Okay, so I have had type 1 diabetes now for almost 20 years. I developed symptoms when I was 50 years old, which is very unusual for a type 1 to be diagnosed.
Because type 1 is usually what people think of is a disease of childhood diabetes.
Type 1 is usually what they used to call juvenile diabetes. And it's usually diagnosed in young kids. Mm-hmm. But there are people who develop, older people who develop it also. So my symptoms began as increased thirst, increased urination, I was losing weight. I was hungry all the time. And after a few weeks of this going on, I knew right away that I probably had type 2 diabetes. We all thought it was type 2. So I went to see my primary care physician, and we did some lab work, and we talked about what I had to do. She provided me with some education. And I made the decision to, I wanted to treat it myself. I didn't want to go on any medication. I was going to lose weight. I was going to start exercising again. And I was going to watch my carbohydrates. And so I did that. I was working at the time, and I would walk every day after work. This went on for 2 or 3 weeks, but I wasn't getting any better. I was tired all the time. The thirst got terrible. I couldn't get enough sleep. I actually had some traveling to do with my job, and I remember being in Dayton, Ohio, in the airport, and I honestly don't remember how I got home. I was so confused and disoriented. So after that, a few days of that going on, getting worse, more tired, I was getting my nails done. I don't know why I wanted to get my nails done through all of this, but I did. It was almost Christmas time. So I knew the technician. She was a friend of mine. And while she was doing my nails, she actually asked me if I had had a few glasses of wine. Because she said she could smell it on me, which actually she was smelling the fruity odor of the ketones that I was burning instead of burning sugar for energy, my body had resorted to burning fats. And so I made it home from the hairdresser, from the getting my nails done. And within a few hours, I was in the emergency room at the hospital. And I was admitted to the ICU for a week. And that's how I spent my Christmas and New Year's and my birthday. So during that time, of course, my lab work was, my electrolytes were all out of whack. They were all abnormal. But the nurses got me through it. The doctors got me through it. And I was discharged on insulin injections, still with a diagnosis of type 2 diabetes.
So the difference between type 1 diabetes is type 1 usually are not producing any insulin.
Type 1 diabetes, your pancreas, the part of your pancreas that produces insulin, is no longer functioning. There are no cells that produce insulin with a type 1 diabetic. With a type 2, well, you know.
Yeah, your cells are, you are producing insulin, but your body isn't able to, insulin is actually a hormone that's needed to bring glucose or sugar from the blood into the cells to be used for energy.
Correct.
So when you have type 2 diabetes, it's usually a disease where it's usually a genetic component to it. Mainly people that are overweight, especially around the middle, and people that are sedentary, that are not doing regular exercise. Those are the main risk factors. There are other risk factors as well. But what happens is you do make insulin versus type 1, you're not making insulin anymore. Type 2, you're making insulin, but you're what we call insulin resistant, meaning that you're making insulin, but you're not able to use that insulin to bring that sugar into the cell. And so your bloodstream gets filled with sugar, and it causes high blood sugar, and then it ends up causing a lot of other complications: eye disease, kidney disease, nerve disease. So for you, you were in the hospital and they still diagnosed you as type 2 because that is common for people of your age group at that time to have type 2 diabetes.
Correct. That's correct. So I was discharged with insulin injections and a sliding scale insulin scale and some minor education. Now, mind you, even though I'm a nurse, a well-seasoned nurse.
Yes, 50 years almost, right?
I still, yes, 50 years. Thanks for reminding me. I still had, it's different when, even though you're a nurse and you have that knowledge base, when it's yourself, I felt like I was at home with a newborn baby. I mean, what do I do now? How do I treat this? How much do I had no idea how to count carbs.
That's a really good point, because when people think you're a nurse, they think you know everything about every disease. But I mean, I'm a certified diabetes educator, so I have a lot of extra education in diabetes. So, we know a lot about a lot of different diseases, but if you really want to specialize in a disease, you need extra training and education. So it's understandably that you, as a nurse, even for all of those years, you still aren't a specialist in diabetes. So to know all the ins and outs of the disease, it's not part of, general nursing knowledge.
That's correct. It's not. So I immediately contacted an endocrinologist and got in to see them. And they drew some blood and did some antibody testing on me. And sure enough, I came back positive with GAD antibodies, which means that I had type 1 diabetes and I need insulin for the rest of my life.
So how did that feel? I mean, were you in shock?
I was in shock. Yeah, I was in shock is right.
Because you're thinking that's a disease of childhood. Like a lot of people think that type 1 diabetes only happens to children.
Right.
But as we see, it happens to adults. Not as often. Definitely type 2 diabetes is definitely more of a disease of the, the aging population. But definitely it happens.
It happens, yeah. And it was an autoimmune disease. I have several other autoimmune issues, health issues. And so this was just another one. It was a shock. But by that time, I had already adjusted to carbohydrate counting, and I knew that I had to exercise. and I knew that I had to have insulin, so I was okay with that. But it's such a learning process. There's so much involved with the disease of diabetes, but
Even
education.
type 2.
Even type
Education
2.
is key.
Education. I can't stress it
Absolutely.
enough. Every day, even now, I still learn. I learn things.
And you've had type 1 diabetes now for, what was it, 19 years
19,
now?
almost 19, 20 years, give or take a year or
Yeah.
two. But
So, and there's great resources for learning too. There's Diabetes Self-Management Education Magazine. There's Diabetes Forecast. There's a lot of different, of course, the internet, the American Diabetes Association. So there's a lot of resources to help people. Plus, there's diabetes education programs. I actually work per diem in the program at Health Alliance in Leominster, and it's a diabetes self-management education program, and people can go there and see a dietitian. And it's really a team of people. You need, it takes a village, right?
takes a
To
big
live
big
with
village
diabetes,
sometimes. Yeah.
right? So you have your dietitian, you've got your endocrinologist, who's a doctor that specializes in diabetes, you've got your primary care physician, you have your diabetes educator, you have your support systems. So there's also support groups that you can join. There's a lot of resources, but you still have to live day to day with the disease.
Yeah, you do. And I still go back to see my nutritionist every so often, just because you have the initial piece of education. I have to go back for tune-ups all the time. I call it a tune-up.
Yeah.
And I stay very close to my endocrinologist every 3 months. I go see her. So there's a whole community of people with diabetes out there, and you'd be surprised how many people, especially children, now have developed diabetes. In the school system, as a school nurse, substitute school nurse, I might say, I come across a lot of children with diabetes. And my hope is that in their lifetime they will see a cure. I may not in my lifetime, but I really hope and pray that they do. But they're all so different, the way they handle their disease. And there's so much technology out there with pumps and sensors, apps on your phone. You can put an app on, the student can put an app on their phone, because the kids now can have cell phones with them.
Right.
And the school nurse can also put that same app on her phone, and she can track their blood sugar out throughout the day.
Really?
Yeah,
Wow.
as well as the parent.
That's wonderful.
Yeah.
So that if they end up in a crisis situation,
If they start to go low,
Yeah.
and the kids are, they have recess, they're out exercising with the other kids. They like to eat with the other kids eat, so they have to be sure that they're covering all their carbohydrates. There's so many factors, that sickness that can affect your blood sugars.
So tell me a typical day in the life of someone with diabetes. Do you have to change your routine, or
No,
do
you can live just as normal life as anybody else. I mean, with some exceptions. You depending on how you control your diabetes, insulin is the drug of choice, of course. But whether it's delivered with injections or by a pump or a pen, it's all the same. You have to keep constant control of your blood sugars.
And this is for somebody with type 1 diabetes, because type 2 diabetes, they may need insulin, but there's also other treatment options. For type 2 diabetes, which the majority of people with diabetes have type 2,
Right.
They diet and exercise, but diet and exercise for you as well. Not going on a diet, but a special meal plan is what we call it. So you have to watch certain things, and then making sure that, type 2, they could be on oral medications, they could be injectable medications, they may be on insulin. And you have an insulin pump.
I have an insulin pump. I went on the insulin pump right away, right after I was diagnosed. I think I used injections for about a month and a half. I went right away onto it.
Okay.
So.
And do you feel what are the advantages of going on an insulin pump?
Well, you don't have to deal with syringes, for one thing. The pump has to be changed every 3 days. The tubing does.
So the site to where you attach it,
Yeah.
and you attach in your abdomen.
I do, but you can attach it to any area in your body that has subcutaneous fat. A lot of kids use their hip
Okay.
or that you can use your arm or your
Okay.
thigh. For me, it's best in, as long as you rotate the site.
And that's the same if you were given injections. You want to make sure you
Absolutely.
rotate your site,
Right.
so that you don't develop scar tissue and make the injections more difficult. And so, as a pump, insurance companies cover pumps?
Yes.
Okay.
Yes, they do.
All right.
But I've found that as an older adult, a senior citizen,
Sandy, you're not a senior citizen.
yes, I am.
Only by number.
Yes, by number. But the insurance companies look at those numbers, let me tell you. And they don't always like to cover a lot of, they would rather cover equipment for younger people,
Really?
especially with the continuous glucose monitoring. It's only been in recently that Medicare and the Medicare Advantage programs have covered the continuous glucose monitor. I also have one of those, but it took a while to get it.
So the pump. So I want to go back to the pump for a minute because you said a lot of the kids in the schools have pumps.
Yes.
Now, does a pump give you more flexibility? So it's actually, tell me what the mechanism behind the pump is. You're getting insulin, and how does that work?
The pump is, I call it my little pancreas.
Okay.
You can put different settings on the pump.
Okay.
It's only as good as how it's programmed, okay?
Yeah.
But you can set up certain basal rates for certain times of the day, and no two people are alike.
Okay.
Some people require more insulin in the morning. There's a period in the morning when your body wakes up. They call it the dawn phenomena, when your hormones and your cortisol levels start to secrete insulin or secrete hormones and so forth. And you require more insulin then. So you may have a setting between, say, 8 a.m. and noontime where you have a certain amount of insulin being delivered. I have maybe 5 different settings.
And therefore, throughout the day, because the way our pancreas works is it gives us a little insulin throughout the day, and then at meal times, prior to meals, it actually gives a large amount of insulin so that we can maintain blood sugar control, and our blood sugars go back to that baseline 2 hours after meals. So this pump actually mimics what our normal pancreas would do.
It does. The only difference is the pancreas knows how much insulin to deliver to your bloodstream to take care of process all the food that you've eaten. And with me, my pancreas is not there, so
Right.
I have to program it.
Okay.
So if I sit down for a meal, it's important that I count all of the carbohydrates and fat grams also that I'm going to eat. So I just enter that into the pump and press the button. It delivers the insulin.
So you do have to have some knowledge. It's not like the pump will operate on its own, even though it has settings. You still have to be very conscious of the types of food that you eat. Carbohydrates, which are coming from fruits, some vegetables that comes from dairy, and the whole and the grains that we eat. So you still have to know how to carb count so that you can give yourself the right amount of insulin to cover the amount of carbohydrates.
Right.
But it seems like it gives you more flexibility. So if you want to go off your plan a little bit, say it's a holiday, and you want to kind of eat a little bit of extra to enjoy the holiday, then you can just cover yourself with the insulin.
Yeah, there's no reason why somebody using a pump couldn't have a piece of cake at somebody's birthday, or like during a holiday, you can't have a couple of cookies. Definitely. It allows for that flexibility in your life. There's no reason why you can't.
Okay. And then the CGM, this is the continuous glucose monitor.
Right.
And it attaches to your pump?
No. Well, there may be some that do that, but mine doesn't.
Okay.
Mine is inserted in the skin. A little sensor goes under the skin.
Okay.
And then there's then it relays a glucose level. It's not blood glucose though. It's because it doesn't go into a blood vessel.
Okay.
It's interstitial fluid.
Yeah.
But so it's not 100% accurate, and you are taught not to treat with the CGM.
You have to verify it with an actual
You verify
blood.
it with a blood stick,
Okay.
yes.
So just because you have a pump doesn't mean you still don't have to check your blood sugar.
I check mine 8 to 10 times a day.
Wow. So when you have a pump, you have to be willing to check your blood sugar.
Yeah, because
that
you're
often.
using regular Humalog insulin. It's very short acting.
Yeah.
So
you want to make sure
you know where your blood sugar is, if it's going up or down, or.
Mm-hmm. And I think that's important for every person living with diabetes. Is blood sugar control is the number one thing that you need to make sure that you stay on top of, because the complications of living with diabetes are the eye disease, the kidney disease, the nerve disease, and you're at higher risk of having cardiovascular disease. And the key to lowering the risk of all of those things is good blood sugar control. So
control your A1C.
Yeah,
right.
So whether you are type 1, whether you are type 2, whether you have gestational diabetes, which is a type of diabetes that women without a prior history of diabetes develops between the 24th and 28th week of pregnancy because of the hormones. And their pancreas can't keep up with the hormones, so they develop what we call gestational diabetes. And this month, National Diabetes Month, we're actually focusing on promoting health after gestational diabetes. So if someone has diabetes in pregnancy called gestational diabetes, when they deliver, when the hormone levels normalize, they don't necessarily develop diabetes. A small percentage may develop diabetes. My sister-in-law is one of them. But what happens is, because you don't develop diabetes at the time after you deliver, doesn't mean that you're not at increased risk. So if you've had gestational diabetes or diabetes diagnosed in pregnancy, and if your blood levels were normal when you delivered, you still are at risk for type 2 diabetes, and so is your child. As a matter of fact, your child is also at risk for child obesity. So what you need to remember is that you need to be tested every 3 years, and your child's physician needs to be notified that you had gestational diabetes, and that they need to be followed closely as well, especially their weight gain. So it's really important that people know that who've had a history of gestational diabetes. So no matter what type of diabetes you have, blood sugar control is the key in checking your blood sugars. Even if your numbers are normal, if you have any change in medications, if you normally don't check, you really should check your blood sugars. For most people, it's really important to do that. So I'm glad that you brought up the blood sugar checks and the CGM. Why would you go on a CGM? What were the indications for using a CGM?
Well, it gives you sort of an indirect measurement of your current blood sugar.
Okay.
I like it because it often prevents me from having a low blood sugar at night, especially.
Yeah.
If you've ever had a low blood sugar, you will know that it's very incapacitating. And as a person with diabetes, you can't 100% prevent them. There are so many things that could, precipitate them. Mm-hmm. Not just what you eat, but exercise. You have to be very careful when you go to the gym, so forth, when you're sick.
Weight changes.
Weight changes. Yeah, if I lose up to 5 pounds, I notice a difference in my insulin requirements. Yeah. But anyway, with the CGM that I have, it will display your blood sugar, and then it will, if it is going to be rising, you will see an arrow going up.
Oh, okay.
If it's dropping, you'll see an arrow going down.
Okay.
If it's going to drop rapidly, you'll have 2 arrows going down.
Right.
So you know that you better eat something or get something in you to...
And so how do you treat low blood sugar?
Well, they tell you, they, meaning the endocrinologists and the people like yourself, the diabetic educators, will tell you that depending on how low it is, but 15 grams, wait 15 minutes.
Right, so 15 grams
check your
of
blood
carbs,
sugar.
Yeah,
Right.
And then wait 15 minutes, check your blood sugar.
Something that's going to get into your blood, your circulatory system quickly.
Right. So
anything with sugar.
Right, but not fat and protein.
Not fat and protein.
Pure sugar. And so I remember when you and I were nurses way back in the 80s, we, candy, giving people candy and those kind of things. But really, when you have a low blood sugar, which you can feel shaky, sweaty, dizzy, lightheaded, kind of confused, some people get nauseated. What happens is your body's saying that your sugar in your bloodstream is very low and you need to get it up quickly. And if you have a candy bar, there's protein and fat, and it's going to delay the response. So you need it up within 15 minutes.
Yeah.
So 15 grams of carbs will actually get your blood sugar up quickly. And so things like sugar tablets or glucose tablets, you need 15 grams. So it's important that you look at how many grams of carbs is in each tablet, because some people will just take one, but really it's either 3 to 5 depending on how many grams of carbs, and then you wait 15 minutes. The other things, you can do a little box of raisins, you can have some orange juice, some regular soda. So it's important that people with diabetes understand how to treat low blood sugar.
Yeah.
And the more low blood sugar that you have, the higher risk that you develop what we call hypoglycemia unawareness, meaning that you don't even get symptoms anymore, and that becomes very dangerous. So it's really, really important that people watch for signs of low blood sugar. And there's so much about living with diabetes, as you said, that going to a diabetes education program, going to your endocrinologist, meeting with the certified diabetes educator and a dietitian is critical. Absolutely critical.
Yeah.
As well as following up with screenings. So what kind of screenings do you go for?
I have my eyes checked every year.
Yeah.
I have my retinas checked every year.
Yeah, dilated eye exam.
Dilated because they want to watch for little tiny blood vessels that could burst.
Yeah.
If they get those in time, then that could prevent blindness. You want to go see your endocrinologist every 3 months.
Have your blood work, your A1C or your
Have your
fasting
A1C
check.
every 3 months.
Yep, A1C every 3 months. You want to go to a foot doctor?
I don't go to a foot doctor. I see my endocrinologist,
And they do a foot exam.
she checks my feet.
Okay.
And right now, I do not have any signs of neuropathy.
That's wonderful.
They test your sensation with a little sharp tool that. If you feel it, then you're okay. If you don't feel it, then they might refer you to a foot doctor. Let's see, what else do I do?
Immunizations.
Yeah, well, it's very important to be immunized, especially with a flu shot. I'm a big advocate of flu shots anyway, but having a chronic disease like diabetes, you do not want to get the flu if you have diabetes, because that can alter your whole metabolism. Your insulin blood sugars will go high,
higher risk of being very sick. So you have to get your immunizations. Hepatitis, there's the flu shot, there's the pneumonia vaccines, and plus all the other regular immunizations that the CDC recommends. And then going for your dilated eye exams, having your cholesterol drawn at least once a year, having your blood pressure checked every visit, taking off your shoes and socks and letting the doctors look at your feet every time you go, and then going to the foot doctor if you're at high risk for amputation because of nerve damage from high blood sugars, having your kidneys checked. So you're right, living with diabetes is challenging, but you can live a full life with diabetes.
Absolutely.
Because you travel, you exercise, you live a very full life. I can never get an appointment on your calendar to get together with you, but you just have to be on top of your diabetes to do that. So.
Right.
Well, I can't even believe our 30 minutes are up already.
Oh, my goodness.
So fast. So I just want to thank you, because the information that you provided today is, I know somebody out there needs to hear it, and it's very, very valuable. And I also want the viewers to know that, you know what, diabetes type 2 is preventable. With it being National Diabetes Month, if you are over 45, you have elevated blood pressure, you have cholesterol, abnormalities, you had gestational diabetes, you have a mother, father, sister, or brother with diabetes, you are certain ethnic groups, you are sedentary, have excess weight around the middle, what you need to do, and I highly encourage people to go to doihaveprediabetes.org, and we're going to put this on the show. doihaveprediabetes.org. Take the prediabetes risk test. You can also go to my website, diabetescarewithak consulting.com. Click on the link. It will bring you to the American Diabetes Association risk test. Take the test. If you score 5 or higher, go to your doctor. Have an A1C or fasting blood sugar checked. And then if you are diagnosed with prediabetes, go to a diabetes prevention program and start making some healthy lifestyle changes to reduce your risk of type 2 diabetes by more than half. So, again, thank you, Sandi, for that valuable education.
You're welcome. It's my pleasure.
And for helping those kids in school. I'm sure they love having
someone. I love the kids, yeah.
And plus you can relate to what they're going through,
and they
which
relate
is
to me, too.
Absolutely.
Yeah.
So you probably learn from each other.
We do.
That's
we do.
wonderful.
You always can learn.
Absolutely.
Get educated.
Education. Go to your local diabetes education program and see your certified diabetes educator. Go to the dietitian and work as a team, because it does take a village, but there's a village out there to help you. So I appreciate you tuning in, and remember to live your best life every day starting today. Next month's show, I'm going to have all my 4 grandkids, and we're going to teach kids how to pack a healthy school lunch. So stay tuned for that. But until then, thank you for tuning in. This is Sherry Keating.